What are the long-term effects of macroglossia? Have you ever wondered how a large tongue can affect your health, especially when it comes to sleep? Macroglossia, which is an abnormally large tongue, can lead to serious long-term effects, particularly in the context of obstructive sleep apnea. Let's break down what that means for you. First, macroglossia can significantly narrow the upper airway. This is particularly true for the space behind the tongue, known as the retroglossal space. When this area is constricted, it increases the resistance in the airway. As a result, the chances of airway collapse during sleep rise, which is a key feature of obstructive sleep apnea. People with macroglossia often experience more severe forms of this condition. This means they may have frequent episodes of apnea, where breathing stops, or hypopnea, where breathing becomes shallow. These interruptions can lead to a lack of oxygen and disturb sleep patterns. Next, let's talk about the daytime effects. If you have macroglossia and obstructive sleep apnea, you might find yourself snoring loudly and feeling excessively sleepy during the day. The fragmented sleep caused by repeated awakenings can reduce your overall sleep quality. This can make it hard to stay alert and focused during daily activities. Now, what about your heart health? Long-term untreated obstructive sleep apnea linked to macroglossia can increase your risk for serious health issues. These include high blood pressure, heart disease, stroke, diabetes, and abnormal lipid levels. These problems can arise from chronic low oxygen levels and increased activity of the sympathetic nervous system during apneic events. If you are considering treatment options, you might face challenges with continuous positive airway pressure therapy. This is the standard treatment for obstructive sleep apnea. However, macroglossia can make this therapy less effective or harder to tolerate. The enlarged tongue can still obstruct the airway, making it difficult for the therapy to work properly. This can lead to treatment failures or difficulty sticking with the therapy. In some cases, surgical options may be considered. Procedures like midline glossectomy or submucosal lingualplasty aim to reduce the size of the tongue. This can help improve airflow and lessen the severity of obstructive sleep apnea. However, the decision to pursue surgery should be made on an individual basis, as results can vary. For children with macroglossia, particularly those with conditions like Beckwith-Wiedemann syndrome, the effects can be even more pronounced. Sleep-disordered breathing can affect growth, development, and cognitive function if not addressed. Treatment options for these children may include both conservative management and surgical interventions. In summary, the long-term effects of macroglossia are closely tied to its role in obstructive sleep apnea. This can lead to chronic sleep disruption, oxygen deprivation, increased cardiovascular risks, and challenges in treatment. Addressing macroglossia often requires a team approach, including medical, dental, and sometimes surgical interventions to improve airway function and overall health.